there have been calls for government in South Africa to drop the remaining COVID-19 restrictions, including the wearing of masks, whether you're in or outdoors. And finally, overnight, the news came that that decision had been made. Health Minister Joe Phaahla has also announced a scrapping on limits around gatherings, as well as border checks for people arriving in South Africa. For more on this, we're joined by Higher Health Chief Executive Officer Professor Ramneek, Ahluwalia, as well as Public Health Association of South Africa President Dr. Harsha Somaroo. A very good evening to you both. Welcome to the program. Dr. Harsha, if I can begin with you. So the Minister today described this announcement as it's a historic day, he said today, and that we're at a turning point. Are we really?
Yes, I think we are at a turning point. I think we've seen a drastic change in the trajectory of the pandemic, in fact, since the beginning of this year. And at this point in time, people are more confident to call COVID-19 endemic in our country. And yeah, I think, like the President said, we have turned the page and we are looking to kind of move on and manage it appropriately for this time period.
And one of the things that's been said, especially since the beginning of this year, is that we need to go into a phase, and we're doing that now in South Africa, where it's basically left to individuals to take care of themselves and be responsible. What do you think that should look like, Doctor, to avoid any sort of serious moments or problems with COVID down the line?
Sure. At the moment, I think as much as the picture, the general overall picture of COVID in the country has changed, there is still risks for people to, for the virus to be transmitted. And I think people need to manage their own risk. Certain people are at higher risk of severe illness with COVID. These include the elderly as well as people with comorbid illnesses. And I think they do need to take special risks. It's not unique to COVID-19. I think for any illness where you have higher risk factors, you would want to protect yourself against that disease. So I think the same would apply to COVID at this point in time.
Professor Ahluwalia, let me bring you in. Have we put the worst behind us, and how do we continue now? And let me ask you a question I asked yesterday with Dr. Aslam Dasu. Are we now going into a post-pandemic phase?
Tough question can be at this stage. But for definitely, as Harsha rightfully said, we are at a far better space than we found ourselves last year at the same time or 2 years back, when a new virus came with absolute no immune system for us to fight. But currently what has happened is that what we see in South Africa and we've seen globally is that 80% of the world population, including South African population, had infections or reinfections of COVID, which has built something called a natural immunity. And while we have vaccinated over 50% of our population, so boosted with it, we got a vaccine immunity. So because we got an immune system which is helping now slowing down the mutating virus, which is what we were seeing in the past, the virus seems to have tamed down. Bit early to say whether it's still gone to the endemic stage, but yeah, it's inclining towards exactly moving out from a pandemic into an endemic. But it has really slowed down. We haven't seen a single variant of concern that has yet shown any potential to replace the Omicron that caused the fourth wave, which is exactly why the Minister of Health, the government of South Africa, has taken a very decisive decision. But yeah, as a global health or as a public health expert or anybody in the public health will still continue saying to the public to be vigilant as much as now there's nothing to worry about because the infections have really decreased. We're clearly seeing the positivity rate is very low. However, we're testing low because people are not needing to test, because even if the infections are coming, they're coming at a very mild stage. Harsha is right. The people with low immune system or people with chronic diseases or comorbidities still needs to be very careful. It remains around us. Our immune system does wean down with time.
Okay.
And that's a natural phenomenon, and so does the vaccine immune system. So
just on that point, Prof,
just
on that point, the point you're making about the immunocompromised and other people who are in the high-risk category, would your advice then be for them to continue to mask?
Absolutely. For me, if you are indoor, you're in a crowded place, you're in a congregation which is crowded, indoor and less ventilated, mask either way will help. It's a public health advisory in winters, when you have close congregations of crowded people, less ventilation, it will not only help you with COVID, it will even help you with influenza and other viruses that still kill people with comorbidities or people with low immune system. So it is highly advisable. However, in general, considering that the virus has really tamed down, we do not see the kind of deaths or the kind of experience we had and the infections are low down. Yes, we can now safely say we do not need to wear masks in congregations which are outdoor or indoors with good ventilations. But I still say crowded indoor, even with people with comorbidities or not comorbidities, it is an important thing to still wear and be preventive and protective.
Dr. Harsha, let me bring you back into the conversation and ask you about testing, which the Prof brought up. So at this point, if one feels ill, you're still allowed, you test, you stay home if you test positive, but people who are around you are no longer taken through the contact tracing process, and they no longer have to stay home for that 7 days period to monitor their symptoms. So what then is the point of continuing to test, say, if your systems are more on the mild end? Your symptoms, I beg your pardon, are more on the mild end. Is there still a point? How helpful is it?
So I think if your symptoms are on the mild end, you manage them accordingly. You may not necessarily want to test, but you should still take care of yourself and stay at home, not expose yourself to other people. If you are going out, wear a mask for certain, and you may not necessarily test. But on the converse side, if you do have severe symptoms, you probably would want more care, and testing would be warranted in that instance. So I think at this point in time, you really have to manage the different types of presentations and the different settings, the risk in different settings.
The Health Minister, Dr., brought up the fact that South Africa has still fallen short of that goal, which was to vaccinate about 70% of the eligible population. Now that we're at this point, do you think it'll actually ever happen, and doesn't even matter if it doesn't?
Well, I hope that we do reach a higher proportion of the population being vaccinated, because the more people who are vaccinated, the more confident we will be that this COVID-19 will be managed. I think that's from the health system point of view and the public health point of view. From an individual point of view, I think everybody who does take the COVID vaccine is protecting themselves as well. So I think if we consider COVID as any vaccine preventable disease that exists, if you do take the vaccine, you are protecting yourself and you're protecting the broader community going forward. At this point in time, we're at a point where we're very hopeful in terms of the changes in the trajectory of the pandemic over time. And looking to the future, there is still some degree of uncertainty, but what we do know is that vaccines are effective in preventing severe illness and death. And I think majority of the people who do pass away with COVID in the country at this point in time are unvaccinated. So there's still definitely a role for people to take the COVID-19 vaccine.
Dr. Harsha, Somaroo, as well as Professor Ramneek, Ahluwalia, good to have your time. Thank you very much.